Osteoporosis physical therapy, why it's important, when to go and what to expect. So you left your doctor's appointment with a physical therapy referral slip. What happens next? Of course, people know when they're in pain, but many don't know when or how physical therapy might help relieve their pain, says Dr. Corbin Hedt, a physical therapist at Houston Methodist who specializes in orthopedics and sports medicine. Physical therapy aims to make lasting improvements to your mobility and strength through guided exercises and education about how your body is meant to move, helping to prevent or relieve injuries or disease. Dr. Hedt is available to answer any questions you have about osteoporosis physical therapy. What is the significance of physical therapy? When a muscle or joint hurts, your first thought is probably to take a pain reliever, rest, and try some ice or heat. However, if the pain persists despite these simple home remedies, it may be time to consider physical therapy. Physical therapy may be beneficial. Strengthen your muscles to relieve joint strain, enhance your balance or mobility, reduce joint pain, protect yourself from harm. After an injury, re-establish function, stability, and mobility. Physical therapists are trained to identify biomechanical deficiencies that are currently causing pain or injury or that may cause pain or injury in the future, explains Dr. Hedt. From therapeutic exercises and hands-on manual therapy to newer techniques and modalities, a physical therapist has a variety of non-invasive treatment options to help address or prevent movement issues. Education is an important component of osteoporosis physical therapy, specifically teaching you how to engage your muscles and move your body correctly. This is especially important if you're misusing any muscle groups. Everyone knows how to move their body, but that doesn't mean they're doing it correctly, Dr. Hedt adds. That's fine, because the way our muscles and joints interact is incredibly complex. We always strive to make osteoporosis physical therapy a life-changing learning experience with long-term effects on how people move and perceive their bodies. Who is eligible for physical therapy? Physical therapy can help with the following common injuries and types of pain: arthritis, back pain and strains, herniated disc, knee pain, rotator cuff tears, sciatica, osteoporosis. However, according to Dr. Hedt, anyone can benefit from physical therapy, including those who are currently pain-free. Not only can a physical therapist help correct an existing injury or pain, but we're also trained to identify and address subtle issues that could lead to pain or injury in the future, Dr. Hedt adds. In addition, sports, pediatrics, geriatrics, neurology, cardiac, and respiratory physical therapy are all subspecialties of physical therapy. A pediatric physical therapist, for example, specializes in helping children with bone or muscle issues, sports injuries, or inherited movement disorders. A cardiac physical therapist, on the other hand, provides rehabilitative exercise counseling and training to those recovering from a heart attack, heart failure, or heart surgery. What happens during an osteoporosis physical therapy session? The last question you probably need answered is what to expect once you understand why physical therapy helps and when it's time to see a physical therapist. An evaluation is the first step in osteoporosis physical therapy. Often, and especially if you've been suffering from chronic pain for a while, this subjective assessment ends up being cathartic for a person. A time to unload the pain and reflect on how much you miss being able to do the things you love, Dr. Hedt says. Following that, your physical therapist will use a variety of functional tests to assess your strength and range of motion, either throughout your entire body or for the specific muscles and joints causing problems. The final diagnosis and explanation of your osteoporosis treatment plan is the final component of your evaluation. We combine subjective and objective assessments to determine what's causing your issue and develop a plan of action to correct it, Dr. Hedt explains. We then explain your diagnosis as well as the specifics of your osteoporosis treatment plan, such as how long you'll need physical therapy and how many visits you'll need. What to expect from your physical therapy follow-up appointments. Following your initial evaluation, you will begin follow-up sessions in which your physical therapist will work with you to implement the exercises, stretches, treatments, and interventions required to correct your issue. The exercises and stretches that your physical therapist guides you through are the foundation of your treatment plan, Dr. Hedt explains. They're designed to improve your strength and mobility, reducing pain and strain on your joints, and they'll continue to be important in helping you stay pain-free. There are also several non-surgical approaches that your therapist may use to help relieve pain and promote recovery, such as dry needling is a technique that uses tiny needles to relieve pain caused by knots and tight muscles. Dry cupping entails applying suction to the site of pain in order to increase circulation and thus reduce inflammation. Kinesthesiology taping gives a small amount of support to a muscle or muscles, reducing pain and promoting proper alignment. Blood flow restriction entails using special blood pressure cuffs to assist a person in gaining strength without overstressing a healing injury. Manual therapy may also be used by your physical therapist to improve joint mobility, reduce scar tissue buildup caused by injury, or help relax tight muscles, Dr. Hedt adds. Finally, there is homework in between follow-up appointments, at-home stretches and exercises to help with rehabilitation. Throughout your sessions, your physical therapist will reassess your condition to ensure you're progressing appropriate.